Slide. So good morning. First of all, I thank Sanjana for that generous intro and for giving me this opportunity. And so, myself, Dr. Aneeta. Today, I'll be speaking on fitting the future. Fitting the future with advancements in contact lenses for optimal keratoconus vision. So, keratoconus is one area where technology has rapidly transformed patient experience. And today we will look how we can use the modern technology wise contact lenses to give your patients the best possible vision and comfort. So contact lenses, is it still matter? Yes, because as the corneal irregularity increases, spectacles simply fail to provide good visual acuity. So even in this era, in 2025, the contact lenses remain the cornerstone for keratoconus management. And our goal is to give maximum visual acuity to the patient and comfort while maintaining corneal health for longer period. So we now have a spectrum of lens options customized to disease stage and the patient comfort. Of course, your RGP and the rose scale lenses are the best optics which you can give to the patient for mild to moderate cases, and they are still the gold standard in mild to moderate cases due to their better optics. And if the patient wants optics as well as comfort, then you can go for the hybrid lens. Hybrid lens have a rigid center and a soft skirt. The rigid center gives better visual acuity and the soft skirt gives comfort to the patient. Then you have the custom soft, that is a tailored design for early to moderate keratoconus when comfort is the primary concern. Piggyback also gives enhancement to the comfort for intermediate cones. This is a soft lens beneath an RGP. This is for patients who love optics but cannot tolerate the rigid gas permeable lenses. Of course, the scleral lenses are the first choice in advanced keratoconus in eccentric cones and also when there is lot of RGP intolerance, because it vault the entire cornea and gives superior comfort. So this is a quick visual summary of the modern lens designs. See, this RGP and rose scale lenses give a 3-point touch fitting, and the hybrid lenses, as I was saying, they have the rigid center and the soft skirt. Example are Synergize. Then you have the custom soft. The custom soft, as you can see in this picture, they have a thick optic. Thick optic can give like contour the cornea, give thicker optics can contour the cornea and give better optics, while the thin periphery can offer comfort. Piggybacking is still a valuable trick for comfort, and scleral lenses gives an unmatched comfort and stability for completely vaulting the cornea and creating a perfect optical surface. So every design has a role, and the skill lies in identifying which clinical scenario needs which lens. Material science also has played a huge role. There are material advances like high decay materials which offer high oxygen permeability. There are asymmetric back surface which can confirm the cone, and also surface coating. So with these designs, we can now confidently offer all-day wear to most keratoconic patients without compromising the safety. The decay values as high as 200K is available. So this is an example. This table I have given due to the different brand names. The high decay materials brand names are Kerasoft IC, Boston XO, Synergize hybrid lenses and all. They have enhanced oxygen transmissibility and increased water content, so they can be worn as extended wear. The asymmetric or the cone specific back surface designs improves the cone conformity. Example are your Rosque 2 IC, again hybrid synergized lenses and all, and advanced surface coatings, the Hydra PEG. These are all available especially in scleral lenses to improve the wettability and to increase the comfort and reduces the deposition. Plasma treatment is available on rose scale lenses, the Boston gas permeable, and most of the scleral lenses. So two breakthroughs are reshaping the contact lens fitting. These are wavefront guided optics and the 3D printing custom manufactured lenses. As you can see in this diagram, the wavefront guided techniques corrects the higher order aberrations like comma, trefoil and all, and it can improve the mesopic and the night vision, and this is primarily used in scleral designs. It measures the eye's optical fingerprint and then it is built, that correction is built into the lens, and they offer excellent rotation stability. So these are given in highly irregular corneas. The 3D printing and the custom manufacturing, they are also topography driven lenses. Scans of the patient's topo is taken, the ocular surface, entire ocular surface is being scanned, and these are converted into a precise lens template. This means faster fitting, fewer trial lenses and much better comfort from day one, and this enhance precision and comfort to the patient. So these are some practical tips, some pearls from day-to-day practice. Do not hesitate to switch the lens category. If a patient cannot use an RGP lens, it doesn't mean that he should not be offered any other lens. He may be a perfect candidate for the scleral lens. And also, for all lenses, educating the patient about the care and expectations dramatically improve the complaints of the patient. Centration is everything in keratoconus fitting. A well-centered lens ensures stable optics, comfort, and reduces the mechanical stress on the cone. For scleral lenses, the optimal vault means there should be no corneal touch, no excessive clearance, and even distribution across the landing zone. And most importantly, the fit must respect the cornea. If there is epithelial insult, if there is apical scarring and all, it is a failed fit, and irrespective of the visual acuity. Even if the patient is having good vision, you should respect the cornea more. So concluding my talk, contact lenses continues to offer the best visual rehabilitation in keratoconus. With wavefront guided and 3D printed lenses, it redefined customization, and the future practice can be a precise, personalized and patient-centric vision. So I usually take up the patient for CXL only after a contact lens trial to determine the visual potential. If there is no improvement, visual acuity improvement with the contact lens, then there is no point in offering CXL and later on taking for keratoplasty and all. So contact lens is of course the cornerstone in keratoconus management. Thank you.
Thank you, ma'am. As madam rightly said, every keratoconus patient has to undergo a rigid contact lens trial, whether it is an RGP or scleral contact lens, because before deciding that they're amblyopic, it is very important. Again, to plan any kind of interventions for these patients, visual acuity, quality of vision is very important. No matter what we do, if you're not clearing their higher order aberrations, if you're not giving them good quality of vision, it doesn't serve the purpose. So always for every keratoconus patient, it's important to undergo a contact lens trial.